Hello friends, welcome back to Dental Exam Guide, and today's video is a continuation of our last video, and we have already discussed about the elevator structures on the teeth surface, cusp, tubercle and ridge. And today we will be discussing about other elevator structures, cingulum, lobes and mamelons, and the depressions on the teeth surface. First one is cingulum. And cingulum is a Latin word for girdle, and it is present in all the anteriors and is most prominent on maxillary permanent canine. And cingulum is the lingual lobe of an anterior tooth, and it makes up the bulk of the cervical third of the lingual surface. Cingulum is smooth and convex both mesiodistally and cervico-incisally, and the marginal ridges extend from cingulum, forming the mesial and distal borders of the lingual fossa. Lingual fossa is a concavity that is seen next to the cingulum incisally, and the cervical boundary of this lingual fossa is formed by cingulum, and usually two developmental grooves. It extends from the cingulum into the lingual fossa, especially on the canine and the maxillary incisors. Next elevator structure on tooth surface is a lobe, and lobe is one of the primary section of formation in the development of the crown. And tooth crown, regardless of its location, it appeared to be a combination of 4 or more lobes, and each lobe represents a primary center of formation. All the anterior teeth show traces of 4 lobes, 3 labially and 1 lingually, and the lingual lobe is represented by cingulum. Each labial lobe of incisor terminates incisally in rounded eminences known as mamelons, and it is prominent in newly erupted incisors, and soon after eruption they are worn down by use, unless through misalignment they escape incisal wear. Maxillary central incisor often show traces of fusion of these lobes on the labial face by visible markings in the enamel called labial groove. In the anterior teeth, the 4 lobes are called mesial, labial, distal and lingual lobes. And in premolars, they are called mesial, buccal, distal and lingual lobes. And in case of mandibular second premolar, which often has 2 lingual cusps, the lobes are called as mesial, buccal, distal and mesiolingual and distolingual lobes. And the molar lobes are named same as the cusp, and the tip of each cusp represent primary center of formation of each lobe. And it is possible to find variation in the number of lobes in molars, and tubercle of enamel may be found in addition to the primary lobes, and when present they are usually smaller than and they are supplementary to the major lobes. Cusp, mamelons and cingulum are representative of lobes, and a mamelon is any one of the 3 rounded protuberances found on the incisal ridge of a newly erupted incisor teeth. So far we were discussing about the elevations on the tooth surface, and next we will move to the depressions on the tooth surface. Depressions on the tooth surface include fossa, grooves, pits and sulcus. Fossa can again be divided into lingual fossa, which are seen only on the anterior teeth, and central fossa and triangular fossa, which are seen usually on the posterior teeth. And fossa is a irregular depression or concavity. Triangular fossae are found on molars and premolars on the occlusal surfaces, mesial or distal to marginal ridges. And they are sometimes found on the lingual surface of maxillary incisors at the edge of the lingual fossae, where the marginal ridges and the cingulum meet. Next structure is a groove. Groove can be a developmental groove or a supplemental groove. A developmental groove is a shallow groove or a line between the primary parts of a crown or root. A supplemental groove, less distinct, is also a shallow linear depression on the surface of a tooth, but it is supplemental to a developmental groove and it does not mark the junction of primary parts. Another grooves called buccal and lingual grooves. They are developmental grooves found on the buccal and lingual surfaces of posterior teeth. We have seen the fossa is named according to the location or its shape, and in case of canine, lingual fossa may be divided into two small irregular fossae by the lingual ridge. And in triangular fossa, which is found on the occlusal surface of all posterior teeth, the base of the triangle is at the mesial or distal marginal ridge and the apex is at the mesial or distal pit. Next structure is sulcus. A sulcus is a long depression or a valley in the surface of a tooth between the ridges and cusp, and the inclines of which meet at an angle. And the sulcus has a developmental groove at the junction of its inclines. Next is pits. Pits are small pinpoint depressions located at the junction of developmental grooves or at the terminals of those grooves, and they are named according to their location. For example, central pit is a term used to describe landmark in the central fossa of molars where developmental grooves join. Buccal pit is a pit on the buccal surface of molars where buccal developmental groove terminates, and lingual pit is a pit on the lingual surface of molars where the lingual developmental groove terminates. Next topic is the landmarks on the root. The first one is root trunk. Root trunk is present only in multi-rooted teeth, and it is the undivided part of the root near the cervical line. And the root trunk is very short and nearly absent in primary molars. Furcation. And the furcation is a place on the multi-rooted teeth where the root trunk divides into separate roots. The mandibular molars and maxillary first premolars are bifurcated and the maxillary molars are trifurcated. That means the mandibular molars and maxillary first premolars have 2 roots and the maxillary molars have 3 roots. Apex of root. Apex of root is the tip at the end of the root. Next one is apical foramen. Apical foramen is the opening at the apex of the root of a tooth through which the nerves and blood vessels pass. And accessory foramina are smaller access ways that branch off of the main root canal, and it can occur anywhere along the main canal. In young developing tooth, apical foramen is large, funnel shaped, and it is centrally located. And wide foramen is filled with the periodontal tissue that is later replaced by dentin and cementum. As the root completes its development, apical foramen becomes smaller in diameter and more eccentric in position. After root completion, apical foramen is seldom located at the very end, that is on anatomic apex. It may be located on mesial, distal, labial or lingual surface of the root, usually slightly eccentrically. Root apex is completely formed about 2 to 3 years after eruption of a tooth. And the roots of teeth may be single or multiple. Both the maxillary and mandibular anterior teeth have only 1 root each, and the mandibular first and second premolars and the maxillary second premolars are single rooted. But the maxillary first premolar has 2 roots in most cases, buccal and lingual. Maxillary molars have 3 roots, mesiobuccal, distobuccal and palatal. The mandibular molars have 2 roots, mesial and distal. And one thing that you have to keep in mind is that Description in anatomy can never follow a hard and fast rule, and variation often occur. And this is especially true regarding the tooth roots. For example, facial and lingual roots of mandibular canine. For the purpose of description, the crown and root of teeth have been divided into thirds, and the junction of the crown surfaces are described as line angles and point angles. Actually, there is no angles, points or plane surface on a teeth except where tooth wear or accidental fracture have occurred. And these line angles and point angles are used only as a descriptive terms to indicate a location. The surfaces of the crown and root portions can be divided into thirds, and they are named according to their location. And examining the tooth from labial or buccal aspect, the crown and root may be divided into thirds from the incisal or occlusal surface of the crown to the apex of the root. The crown is divided into an incisal or occlusal third, a medial third, and a cervical third. And the root is divided into a cervical third, a middle third, and an apical third. The crown may be divided into thirds in three directions. The first direction is from inciso or occluso-cervically, the second is from mesio-distally, and the third is from labio or bucco-lingually. So inciso or occluso-cervically, as we said before, it is divided into incisal or occlusal third, middle third, and cervical third. Mesio-distally, it is divided into mesial, middle, and distal thirds. Labio or bucco-lingually, it is divided into labial or buccal, middle, and lingual thirds. Each surface of the crown may be so divided, and they are named according to their location. And now we are going to see what is line angle and point angle. Line angle is formed by junction of two surfaces and derives its name from the combination of the two surfaces that join. The line angles of anterior teeth are as follows: mesiolabial, distolabial, mesiolingual, distolingual, labio-incisal, and linguo-incisal. So the anterior teeth have 6 line angles. Because the mesial and distal incisal angles of the anterior teeth are rounded, mesio-incisal line angle and disto-incisal line angles are usually considered non-existent. And they are spoken of as mesial and distal incisal angles only. And in case of posterior teeth, there are 8 line angles. They are mesiobuccal, distobuccal, mesiolingual, distolingual, mesio-occlusal, disto-occlusal, bucco-occlusal, and linguo-occlusal. Point angle is formed by junction of 3 surfaces, and the point angle also derives its name from the names of the surfaces forming it. For example, the junction of mesial, buccal, and occlusal surface of molar is called mesio-bucco-occlusal point angle, and both anterior and posterior teeth have 4 point angles. The point angles of the anterior teeth are mesiolabio-incisal, distolabio-incisal, mesiolinguo-incisal, and distolinguo-incisal. And the point angles of the posterior teeth are mesiobucco-occlusal, distobucco-occlusal, mesiolinguo-occlusal, and distolinguo-occlusal. With this, this topic is almost over, and in the next video I will be discussing previously asked MCQs from both the board exams and PG entrance exams.